Hello everyone. Welcome to the lecture series on health management. In the previous lecture, we discussed in detail about the modeling and simulation. Now, let us discuss the use of simulation in healthcare. Simulation plays a crucial role in healthcare by providing a safe and controlled environment to replicate real-world scenarios for training, research, and process improvement. Key uses of simulation in healthcare are: Number 1. Medical education and training. In medical education and training, the simulation can be used in clinical skill training, surgical training and emergency response training. For clinical skills training, medical students, nurses, and healthcare professionals use simulators to practice and enhance clinical skills such as taking vital signs, performing physical exams, and administering medications. During surgical training, surgical simulators and virtual reality simulations allow surgeons to practice and refine surgical techniques before performing procedures on patients. For emergency response training, healthcare teams can simulate medical emergencies like cardiac arrest and trauma. It can also be used to practice teamwork, communication, and life-saving interventions during emergencies. Number 2. Patient safety. For patient safety, the simulation can be used for error identification and prevention and medication safety. For error identification and prevention, simulation scenarios can recreate potential medical errors or adverse events, helping healthcare providers identify and prevent mistakes, improve communication, and enhance patient safety. For medication safety, simulations can be used to train healthcare professionals in medication administration and reduce the risk of medication errors. Number 3. Clinical decision support. For clinical decision support, the simulation can be helpful in clinical guidelines testing and patient pathway optimization. For clinical guidelines testing, simulation can evaluate the impact of new clinical guidelines, treatment protocols, or diagnostic procedures on patient outcomes before implementation. For patient pathway optimization, hospitals use simulation to optimize patient pathways and resource allocation to reduce wait times and improve patient flow. Number 4. Medical equipment and technology evaluation. In this field, the simulation can be used in the testing of medical devices and health information systems. Simulation allows testing and validating medical devices and equipment, ensuring safety and efficacy standards are met. For health information systems testing, electronic health records and healthcare software can be tested and refined through simulation to ensure they improve patient care and workflow efficiency. Number 5. Research and innovation. Simulation can be used in various fields of research and innovations, like clinical trials, disease modeling and drug discovery. Simulation can model clinical trial scenarios, potentially reducing the need for extensive animal or human testing. For disease modeling, researchers use simulation to model the progression of diseases and assess the impact of different treatment strategies. Computational simulations assist in drug discovery and drug-target interactions, saving time and resources. Number 6. Team and communication training. Simulation can be helpful in training health professionals for interprofessional collaboration and crisis resource management. For interprofessional collaboration, simulation facilitates training for healthcare teams, enhancing communication, teamwork, and coordination during patient care. For crisis resource management training, healthcare professionals can practice managing crises and allocating resources efficiently. Number 7. Human factors and usability testing. In human factors engineering, simulations help identify and mitigate potential human errors and ergonomic issues in healthcare settings. For assessing usability testing, medical device and software developers use simulation to assess the usability and user experience of products by healthcare professionals. Number 8. Telemedicine and remote consultations. Simulation is helpful in telemedicine training and its technology evaluation. For telemedicine training, healthcare providers can practice telemedicine consultations and remote patient monitoring using simulated scenarios. For telemedicine technology evaluation, simulations assess the effectiveness and usability of telehealth platforms. Number 9. Pandemic preparedness and response. For pandemic preparedness and response, simulation can be helpful in epidemic modeling and training for healthcare emergencies. During epidemic modeling, simulations can predict infectious disease spread and assess public health interventions' impact. Healthcare providers can train for pandemic situations, improving preparedness and response for healthcare emergencies. Thus, simulation in healthcare contributes to improved patient outcomes, increased safety, enhanced training, and more efficient healthcare delivery. It allows healthcare professionals to learn, practice, and innovate in a risk-free environment, ultimately benefiting both providers and patients.